So we're here with the founder of Mitochon Systems, Dr. Andre Vovan, and we're here with 5 questions for EHR executives. So we're going to start with the first question. What differentiates your EHR today?
Well, John, Mitochon was never described and was never designed to be an EHR. We wanted to have a platform for physicians to connect, collaborate, and coordinate. And within it is the EHR functionality, but we're really a free HIE, PHR, and EHR platform. And the reason why we designed it that way is that we think that EHR by itself is incomplete for the functionality set for the workflow for the physicians. So we wanted to put everything together on the table. And especially at this HIMSS, we're going to be announcing that we're adding 3 other frees to our current frees.
Free.
Yes, free PM, free e-prescribe, and what was the last one?
Mobile app.
Yeah, and free mobile apps on there. So what our platform would allow a community of physicians to do is get on board onto our network, instantly connect with each other, share patients' information, coordinate the care, now doing it on a mobile platform. And one of the last things that we underestimate the needs was the integrated PMs. A lot of physicians were asking for both back end and front end all together as one. We initially came out thinking that we could work with other PM software with it, and we have, but the physicians are still asking for, hey, when are you coming out with the free PM? So here we are. We're going to be making that this year.
Excellent. And question number 2 is, in what ways has the EHR stimulus money and meaningful use had an impact for good or bad on the EHR industry?
But the interesting part was that back in 2006 when I started out with this program, we came up with the free model because it was unaffordable. So we created this before the stimulus money came about. And it was surprising to us that the stimulus money came in. So on our standpoint, it was a good way to increase the knowledge base for the physicians and increase their awareness that IT is necessary. But I'd also think that the fact that the meaningful usage criteria were placed into there, it somehow made EHR moved it away from the central reason for why a physician would adopt an EHR. So now they're trying to do it for the RS stimulus money rather than really using it to help their patients. And I'm not sure whether or not meaningful usage really will lead to improved outcomes, and that's the big challenge right now that we see.
Definitely. And number 3 is, what are the top reasons why doctors are adopting EHR software?
Well, I think, again, the physicians who are adopting right now are trying to fit in with the RS stimulus, I think, right now. For other doctors, I think they're trying to advance their technology platform in their offices in hope of being improved on efficiency in there. And I think the other one is that they realize that coming up in the future, their payments are going to be somewhat tied to that, although that's hard to convince them of right now. We think right now most of the physicians in the last year has been doing it mainly because of our stimulus on there, which is, I don't know whether or not that's the right way to go about doing it.
All right. And what are the main reasons that doctors aren't adopting EHR software?
I think still it's cost, and as well as what's it going to do for me. So the cost is still prohibitive for most physicians on there. I think most of them are under tremendous pressure, both from the healthcare reform, knowing that the payments are being cut in the future. On top of that, there is also that percentage of Medicare payments that is threatening them every year with the cuts anyways.
Right.
On there. So cost is one. 2 is technical difficulties. Most of them just don't have the technical know-how in their offices to take care of things. That's why we have a cloud platform instead. And then the last thing right now, I think, is that I think they're just afraid of how much work is really necessary to get to that meaningful usage dollars. You know.
Interesting. And so the last one, 5th question, is, what will differentiate your EHR 5 years from now?
Well, I think from our standpoint, 5 years from now, we're looking more beyond an EHR platform, as we said before. We think that our platform will allow a community of doctors to instantly connect to each other and have all the workflow built in with each other. We think that's where all the needs are. We need for physicians to be able to effectively and efficiently coordinate care with each other. And that is beyond what is in meaningful usage and stuff right now, and that's what we're building to. We think that while it's great for physicians to try to get that RO stimulus money, I think the drive is more like, if I can get their office working more efficiently, having better care and outcome for the patients, that's what they're looking for.
All right. Thanks a lot.